Hello, classmates. Today I will be telling you about the Hangman Fracture. So, this fracture occurs at the neck and it particularly affects the second cervical vertebra, which is also commonly known as C2. So, the C2 vertebra has a variety of functions, um, one in the flexibility and the stability of the neck. One of the major functions of this vertebra is it allows the head to rotate. And this is through a key feature that it has known as the ontoid process or the dents. And it acts as a pivot for the rotation of the C1, which is also known as the atlas, and the head. So that's kind of how this anatomy allows the head to rotate left and right. So this particular fracture um, mainly involves a break in the pars interarticularis. And this is the bony arch that connects the front and back parts of the vertebra. So when this arch breaks or fractures, it causes instability between C2 and C3 vertebras. And the reason we get this name of hangman is because this C2 break is due to a extreme hyperextension and axial loading force on the neck. So when we commonly see what causes this injury is in motor vehicle accidents. So when you get in an accident, you kind of have like that head bounce, which forcibly throws your head backwards, and you see that hyperextension occur. So this can lead to that break occurring in the pars interarticularis. And it's also very commonly seen in sports injuries. For example, like in football, when someone gets hit, that same type of head forcibly being thrown backward occurs, which leads to the hyperextension again. So, um, in this injury, there are four types of classifications. So the first type of classification, there's a very minimal displacement of the C2 vertebra. In type 2, there's significant displacement with potential instability. And then in type 2, there's a type 2A, which there's a displacement without angulation, but it's a widening of the C2 and C3 disc space between that. And the type 3 fracture, which is the most severe fracture, is associated with a facet dislocation and causes instability. So there are the ways you would diagnose this is mainly through x-rays. CT scans and MRIs can also be used. MRIs are more often used to assess, if there's any ligament injuries or soft tissue damage. But through an X-ray, you can see, the fracture clearly occurring, and I'll add an image of that in the post as well to see the difference of a normal C2 and a damaged C2. So when this injury does occur, there's various physiological processes that can occur, and one of the major ones is a local inflammatory response. So when a fracture of the C2 vertebra occurs, there is an immediate response that leads to inflammation. And that's by damaged cells releasing pro-inflammatory cytokines such as IL-6 or TNF-alpha. And another thing that can also occur is swelling around the fracture site because due to the pressure occurring in that area, and this can also cause an edema in that specific area. So in treating this fracture, There are either a conservative or surgical treatment needed. So, a conservative treatment usually is for type 1 fractures, and that will require a rigid cervical collar. It's a type of brace, and you pretty much wear that for 6 to 12 weeks till the neck is stabilized and able to heal. There also has been the use of a halo vest immobilization. This is for more serious cases, but in which a surgery was decided it was not needed. And the halo vest pretty much immobilizes your head and neck for a certain amount of time. Now, in a surgical intervention, there can be the anterior cervical discectomy and fusion. This is where the C2, the disc which is damaged between the C2 and C3 is removed, and the vertebrae are fused together, which will improve stability of the neck. And there is also a posterior cervical effusion, and that's commonly more used where the back of neck fusion is required to add stability. So the treatment pretty much depends on the severity of the case and the type of fracture that has occurred. And so thank you for listening to my post about Hangman's fracture. Thank you.